Hey everyone, I'm Dr. Tyler J. Tolbert, owner of Smile Now Dental Group. If you've been researching full arch dental implants, you've probably seen ads that promise permanent zirconia teeth in 24 hours, which you typically receive the very next day after surgery. It sounds great on paper. You can fly in, get surgery, and walk out the next day with your forever smile. But here's the problem. It's not that simple, and forever comes with a few conditions. If you rush this process, you could end up with a smile that looks okay for a moment, but doesn't fit, function, or last the way that it should. In this video, I'll explain what 24-hour zirconias actually are, why that timeline isn't biologically realistic, and how we do things differently at Smile Now to give you a result that you'll love for many years to come. Let's be clear, zirconia teeth are amazing. They're strong, beautiful, and long-lasting. But creating a custom zirconia prosthetic that fits perfectly and feels natural is not a one-day job. Many patients we see at Smile Now have been missing teeth for years. Their jaw structure, bite, and muscle memory have all adapted to not having teeth. Your brain literally forgets how to chew, how to pronounce certain words, and how to balance pressure. To suddenly give you permanent zirconia teeth in 24 hours without any adjustment time, it's like buying a car without test driving it. You might be able to drive it off the lot, but how is it going to feel or perform long term? That's a gamble. These fast turnaround clinics often don't talk about how many times they have to redo their cases. Why? Because they didn't take time to prototype their smile. They didn't allow time for functional feedback, or the teeth just don't look, feel, or fit the way they should. In fact, many patients end up starting over completely after realizing something's not right, and that quick fix becomes a costly redo. At Smile Now, we'd rather do it right the first time. While we certainly could provide 24-hour finals, we instead follow a biological timeline, allowing for the body to heal and seal the implants in place, as well as giving you time to adjust to your new smile. We can't rush biology, and in order to make you finals that we know will last, we use the prototype phase to ensure that you are satisfied prior to moving to final materials. Here's another big problem: soft tissue changes. That means your gums. Right after surgery, your gums are swollen. Your immediate teeth are made according to the location of those swollen gums, which will naturally shrink as healing progresses. So what do you think happens if we make an immediate prosthesis or bridge that's actually your final? Well, you're going to end up with gaps underneath your teeth, food getting stuck in those gaps leading to poor oral hygiene, which limits the life of your implants, air escaping while you talk leading to speech issues, and frustration trying to clean or eat. You deserve better than that. You deserve a prosthetic that fits when your body is actually healed. Just because someone gives you zirconia teeth 24 hours after surgery does not mean that your implants are healed. Implants go through a biological process called osseointegration, where they fuse with your bone. That takes months. If you load full-strength, inflexible zirconia teeth on implants before they're ready, here's what you risk: implant movement, which leads to a loss of integration, total failure of the case, and ultimately having to do this all over again. So that's what we mean when we say, don't build a house on a cracked foundation. Zirconia is an incredibly strong but unforgiving material. It must fit with micron-level precision, the kind of fit that is not predictable using measurements taken in a surgical, unhealed field. At Smile Now, we take measurements before surgery, during your healing process, and again after the implants have healed, once your soft tissue and the bone have settled into place. We have smile design appointments where we see the progress, we get feedback from you about what you do and don't like, and it helps us shape that final result to make sure that it's something you'll be happy with long term. That's how we create a smile that's uniquely yours. Here's one of the biggest downsides of 24-hour zirconias. You don't get a say. The design options are made for you before you've had time to even try them out. There's no feedback, there's no adjustments, and often no recourse once it's all done. At Smile Now, we go through multiple prototypes, record appointments, aesthetic reviews. We really take the time to make sure that things are where they belong and that your brain and your mind have gotten used to these new teeth. Ultimately, you are getting a say in how your teeth are going to look, how they feel, and how they function, because it's your smile, and you deserve that. I've personally known providers who tried to offer 24-hour smiles, and they end up switching back. Why? Because the complications, the remakes, and the unhappy patients made it totally unsustainable. At Smile Now, we respect the biological timeline. We wait for proper healing, we account for your habits and your bite patterns, and we track changes in your speech, muscle memory, and chewing. Only once you're ready do we go to final. That's how we create custom, long-lasting results that you're proud of, not rushed ones that you end up regretting. So if you're considering full arch implants and wondering whether you should go for the quick zirconias, take a breath, just a pause. Think long-term, think precision, think quality, measure twice and cut once. Simply click the link in the description to schedule your free consultation at Smile Now Dental Group, and we'll walk you through the process. We'll show you why our approach works and help you build a smile that's not just fast, but it's built to last. Thanks for watching, and don't forget to like and subscribe for more insights on getting the best results for your dental implants. We'll see you in the next video.